Good afternoon. It's a pleasure to address this group. It's really an honor, and to actually be in this venue, which I have not been in before, so it's very cool. And it's a glorious day outside, and I can see that sun is kind of beaming through on some people, but it's great that you would take time to be here and talk about the impact of affordable, stable housing on the health of residents of Lane County. So this is important work, and as Richard pointed out, I've had the pleasure of overseeing community-based services for the last few years for PeaceHealth, which really encompasses Lane County, and really looking at how we create a healthy community as your healthcare partner amidst many other partners. And this has been a great time. And I think we have an unusual opportunity, so I'm very excited. Today, I get to tee up really what is going to be probably the impactful words that are going to really come from one of the residents that's been a part of this amazing collaborative effort, and one of my colleagues, Dr. Pilar Bradshaw, who's going to talk about the impact on her patients and the people that she has the pleasure of taking care of. So again, I think this is going to be where you're going to start to see where there's really the strong connection between what we do as a community and the health of our community, and how we can be very purposeful in those actions. And many of you are here because of your roles that you're doing today. And again, we want to excite you that this is time well spent, and these are resources very well spent. I just wanted to sort of set the stage by talking about sort of the historical perspective of our time. And this is an amazing time of change. And I'll have to say that it's really unprecedented as a healthcare provider to really begin to talk about health. And we have been so focused on health care in America that we've sort of forgot about health. And because of the economic factors of not addressing health, we're seeing an accelerated cost, and the cost is really becoming the driver for the discussion. So as we have now eclipsed 18% of the gross domestic product in healthcare cost, it's affected our ability to be viable economically with the rest of the trade of the world. And that started to push some levers. As we looked at that, we've also said, okay, what are we getting? We're spending twice as much as any other industrialized country on healthcare. What are we getting? And the current rankings with the World Health Organization are 37th in the world with respect to our health status. So we're paying twice as much as any other country, and the product that we're receiving as far as health is not the same, and that's because our focus has been on those dollars, has been about healthcare. Discussion today is really about health and the impact of one very important aspect of health, and that's stable housing. If all of you remember sort of Maslow's hierarchy, reality is you got to have housing, you got to have food, you got to have some key things before you can even think about doing something else. So this is where this work is so important. The Affordable Care Act of 2010 provided a sort of platform for significant change across the country. Much of our focus has really been about the insurance part of that, really the expansion of Medicaid, which has caused some stress in our community. But the reality is it's much more than expansion. It's much more than the exchanges and the lack of IT ability to make that work in our state. It's really about changing healthcare. And so there's a focus within the 1,100 pages of the Affordable Care Act, which actually looks at how we deliver care as well as how we partner across communities. And one of the amazingly brilliant things that was put into that legislation was really the creation of an intentional partnership with health systems and communities around the Community Health Needs Assessment and Improvement Plan. And that work has actually brought several partners together across our community over the last 3 years to create our community's plan for getting healthy. And so that has been a partnership between PeaceHealth, between Trillium, at United Way, and as well as the Lane County. Now, Lane County has always been in the business of public health, but the rest of us really haven't. And so now we're all in the business of public health, and we're doing that through the vehicle of the improvement plan. Where that ties into this work is one of the areas that we looked at really had to do with access. Much of the way we think about access in healthcare is, well, can you go see your doctor? But the reality is when the community looks at access, they look at access for other important things. Do I have access to food? Do I have access to stable housing? Do I have access to care? Do I have access to transportation? A whole variety of other things. So as we went through that, those things were highlighted, and clearly stable housing was on the top of their list. It also, housing affects the areas of focus with respect to tobacco, respect to nutrition and activity, and our ability to try to control obesity and its health effects, as well as behavioral health, how we support that, how we have supportive communities, and really how we address significant health disparities in our community, because we know that those disparities exist, and the improvement plan has allowed us to take a look at those things. The other thing that's happened in Oregon that hasn't happened in all states is the creation of coordinated care organizations. And that legislation that Oregon has really has allowed us to have a much more purposeful partnership across what I'll call silos of care. We brought together behavioral health, we brought together transportation, physical health, we're looking at housing, we look at long-term care, you're looking at pharmacy, dental, a whole variety of things which had always had their own silo. Now, by working together in a collaborative model, we can try to provide the wraparound services that are necessary for people to actually get healthy enough to have a job, healthy enough to be able to have stable housing, and to be productive parts of our community. And without those resources, very difficult to do. So the current healthcare market, like many of you are aware of, is challenging. And clearly the expansion of Medicaid has created a lot of stress. I'm a family doctor, and so there aren't many of us left. And so the reality is trying to be able to provide comprehensive primary care has been a challenge for our community, but we're making efforts collaboratively to try to help to create and support care for really somewhere between 30 and 40,000 new Medicaid recipients in Lane County. So that's been a challenge. We've also understand the increased regulatory burden that's placed on many of us and many of our businesses, but clearly in healthcare. And we've had to address some of those things by streamlining and really trying to look at the most effective ways to provide care. But the reality is today healthcare is largely what we call a fee-for-service. It's transactional, so we do something and then we get paid. And the future is not that. The future is really to say, we have this much money, we need to keep this population healthy. You figure out the best ways to do it. And the only way that that will happen is through collaboration. It's not going to happen just through healthcare. So this is the future market is really looking at things like our nutrition sources, our food, our housing, looking at education and the partnership specifically with having healthy kids. So how is it that we create family environments, home environments, stable environments that allow our children to be healthy enough to succeed in the future, to succeed first of all in school and then onward. So again, it all starts there. Now that requires that we make an investment now. We won't see that return on investment for decades. But that's where we have to go, and even in healthcare, we have to start saying, where are the investments we're going to make, not in the short-term return, but in that long-term return, and that's where health is going. And the exciting part about that is it brings communities together to do really what's the right thing. And Cornerstone is an example. I've had the pleasure to work with Richard and Michelle for some time on the work that Richard described around the use of a community health worker, again, to have help with navigation, to help with health coaching. They also have a partnership with Food for Lane County, so they can bring food and teach cooking and a whole variety of things that are just like amazing. And those are skills, those are things that really make people healthy. And again, we can't afford to become an increasingly unhealthy society. We know that we're getting older, all of us, unfortunately, but the reality is, or fortunately, the reality is with that age becomes increased health burden. And so as we go forward, what we want to try to do is, can we sort of be healthier going into that aging environment? Can we have less complex and chronic disease. The only way we can do that is beginning with our kids, beginning with our communities, and really creating healthy environments so that we don't have that same disease burden, because we simply can't afford it as a country. The science of housing is where all of this comes together, and the reality is that there are a lot of studies, and hopefully many of you are aware of them, around the health impact of housing, and Pilar will probably talk a little bit about this as well, but having stable housing dramatically reduces healthcare costs. So in environments, particularly if you have areas where you can help people to be independent in a supported environment, it's half the cost of institutionalized care. The reality is the downstream cost of the disease burden is dramatically affected when they have stable housing. They know they have a meal on the table. They have supported community, so they actually have a sense of community, a sense of belonging, a sense of purpose. People actually are healthier and need less health resources, and that's clearly been shown. There's a group that's working in Portland that's literally cut the costs in half of the Medicaid recipients just by having folks in a supported living environment. They went from $2,000 a month down to $900 a month of actual Medicaid costs just by having supported living. So there's a if we really want to try to bend that cost curve that Richard talked about, we have to deal with the basics first. And clearly housing is a key part of that. We also have the Eugene Springfield consolidated plan for this year has been in process of being rolled out, so to speak, and it points out that we have some significant issues in Lane County. We have substandard housing. We have areas where affordability is really difficult, where well over a third of a person's income is actually spent on their housing, leaving them very little ability to do and support themselves in other ways. So we have affordability issues, we have structural issues, things that we are going to have to come to grips with, and it clearly affects people of low income far more than folks that are of higher incomes. Dramatically affects, and those health outcomes are significant. We also have significant homelessness, and many of you are aware of that. So how do we as a community begin to address some of those complicated things? At point of time testing, every year they go out and sort of do a count. This last count had almost 1,800 homeless individuals that they identified, of which about over 400 were chronically homeless, and many of those people have serious and persistent mental illness. And so how is it that we as a community begin to address that? Because there's substantial health impact. When we look at the cost of care for someone with a serious and persistent mental illness, it can be 5 to 6 times the cost of someone without those types of diagnoses. So how do we create stability? That's where all of this work is going. And we also have special needs populations that really have significant disabilities. If we support populations in that environment, also substantially healthy. And there's many efforts in our community that have done some fabulous things, really trying to support those people with significant disabilities and improving their life and subsequently their health. So I think that as a community, we've done a lot of things. I think we have quite a ways to go. And I think that our challenge as a community is really to be a community. We can be our individual selves and do our own thing, but these are the opportunities and the challenges that we have, is to come together and do things together collaboratively. We have several vehicles by which we can do that. Cornerstone Housing clearly is one of those that's really looking at a community approach to housing and looking at ways to try to help their residents to live healthier lives and really move forward. So I think that we have some challenges ahead. We clearly have to look at sort of the social determinants of health. We have to look at those things, and we have to do things as communities to support people in a much more developed way. We also have to look at how we fund things, and we're starting to see shifts in the healthcare dollar where healthcare companies, and particularly in the CCO, are actually actively investing in their community. They're taking dollars, setting those aside and putting them into prevention, putting them into efforts to try to actually improve health rather than just distributing dollars for healthcare. Very different approach, very, very different. And I think we're fortunate. We have a community of very engaged people. We can, and we have a tremendous level of creativity and imagination of what that could look like. We're not afraid of sort of the daunting challenges. When I am in other parts of the world and talk with other healthcare leaders and across the country, the reality is they're not thinking about any of this stuff. So they're still trying to figure out how they can do their operations in the most cost generating manner rather than necessarily the most cost efficient. So I think that we're in a unique place. Eugene is a unique community within a unique state, and I think we have a tremendous opportunity here. We are looking forward to, we're in the process of going through our next Community Health Needs Assessment Improvement Plan. As that rolls out, I hope many of you can engage in that work, and it can be our community's plan to be more and more healthy. And again, I want to thank all of you for your leadership and all of your organizations. You have a voice that's strong. You have a voice that can carry for those who really don't have a voice, and that's who we're trying to serve, the vulnerable. And so again, I just ask you to really get on board with this work, and just being here today is really great evidence that people care, and people care about having stable housing. So I do want to thank you. I have the pleasure of introducing one of the residents. This Amber Gaborialt is a resident in our facility, one of the facilities, and we also we'll get our cleanup crew here. But Amber's going to come up and tell us a little bit about what it's like to live in this kind of environment, to understand the support of a nurturing community, and how that creates some unique opportunities. And so it's a pleasure to have Amber come up. It's living proof that this is powerful work.